Hi, this is John Kelly from Loghouse Clinic, and I'm Irene Tracy from Smovey Health. These are Smovies. They are Austrian exercise and wellness tools. They are used in exercise and rehabilitation. John uses the Smovies in his clinic in Tramore. So John, can you tell me please how you incorporate the Smovies into your clinic?
Okay, if you'd like, I'll just give a brief demonstration on Peter here and how I use it. In my clinic I do an awful lot of deep tissue work. So what I do is, how I incorporate the smoothies is, first of all, I would use them at the start of the session. So I normally do this to help relax the client. It helps stimulate the muscles, it helps stimulate blood flow, and it gets the person ready for more deep tissue work. Okay, so normally what I do is I'd get the patient nice and relaxed, and I'd start from the top here. So I can start onto the shoulder, and I would just come back and forth over the shoulder area. Now as we're doing this, we're targeting all the muscles, all the tendons and ligaments and attachment sites in and around the shoulder area. Okay. So then what I do is I come into the spine here. So the thing about the smoothies is they're very light, it's a very light therapy, and it's very safe to use over the spine. So what I do is,
Any pressure at all?
no, I'm not putting any pressure at all, no. So that you just let the smoothie do the work. You just let it rock back and forth and let the vibrations penetrate into the body. How does that feel, Peter?
Good, yeah.
So what I'll do now is I'll work down and back up the spine. So as I do that, all the muscles in the back and all the attachment sites on the spine are getting stimulated. So this is helping to relax all those muscles that are attached in and around the spine. So I can back up. Back up towards the neck again, and back over towards the other shoulder. So again, the smoothies and vibrations are penetrating into the shoulder, over all the muscle groups. And Peter, you'll probably feel that come to the front of the shoulder as well. So after I've done the shoulder and spine, I'll then come back into the center of the body and use the smoothies to come up and down along the back. So I can just let them rock, and again there's no pressure. It's just back and forth, back and forth, back and forth. How's that feeling, Peter?
Very good,
Does that feel relaxing?
yeah.
Okay. Okay, then we come back down to the lumbar spine, down over the sacrum. This is quite nice. Again, we're over bone, we're over tendons and ligaments, and this is quite nice, quite relaxing. And it's not sore at all, is it? No. So then what I do is I come back up along the erectors. Working all the way up along the back. Now I'll come to the other side of the spine and walk down. Until I reach the bottom again. And you can do that a couple of times, like you can walk back up and down. Okay, so then I'm going to go back onto the legs and back over the sacrum. Again, we're going to work from here down into the glutes, the hamstrings, the calves.
I work with a lot of people in the Irish Wheelchair Association.
Yeah.
And they say that going over the glutes is particularly releasing for them, that they hold a lot of pressure and pain there.
Yeah, I suppose like people in wheelchairs are basically sitting on their glutes a lot, and it causes an awful lot of compression on the muscles.
Yeah.
It would affect circulation in that area.
Yeah.
So this would help soften it up, and it would be very nice and relaxing for them.
Yeah. And it's not intrusive or
No.
it's not embarrassing or anything.
No.
You're literally just going over it. It's grand for
Yeah,
the person giving the massage and also the person.
that's it. And you can see
yeah.
Peter has all his clothes on, but he's
Yeah.
still able to get the benefits of this tool because it works, it penetrates into the body, and it penetrates through the clothes.
Yeah.
So now you can get in on the different muscle groups in the glutes, like the glute max, glute medius, minimus, piriformis. These are all been worked here. Okay, and when we have that done, we spend a couple of minutes on that. Then we'll go back down into the hamstrings. Just see then, you can keep this moving. You get the medial hamstrings and then come back at the lateral hamstrings. And I can work down along them and then back towards the center. And as you can see, it's safe enough to go over the knee as well, like, you know, so there's no pressure on the knee at all. You can just kind of gently rock it back and forth over the knee. There's no pain at all with that, is there, Peter? Okay. So then after that then, we can work down into the calf muscles. And work the gastrosoleus. Come down towards the Achilles.
That would be very good for any sports people as well, wouldn't it?
Yeah, a lot of runners, okay, would be suffering from tight calf muscles, and you know, this would be just perfect for them to kind of help soften it up, especially after a long run. If they could just get somebody to massage their calves and legs for them. So then again, you can get directly over the tendon like this. If they're having any tendon issues, this would be a nice and intrusive way of sort of treating it. How's that feel, Peter? Now, if you want as well, you know, depending on what kind of treatment you're doing, you can actually bring the foot up, and then obviously with shoes off, you could treat the foot as well and all the reflex areas in the foot. You know, but this time we're just concentrating on the massage. We'll get after that. Yeah, go ahead.
I also work with a lot of people with Parkinson's, and giving the full body massage like this really helps release the pain and all over.
Yeah.
But it gives a lovely, gentle, relaxing feeling. And when you do the massage on the sole of the foot, it really just sends a calmness through the whole body, right up to the head. Even if you have a headache, it'll take away a headache.
Yeah, yeah, and you can see like reflexology is a therapy where they treat the whole body through the feet. Like, so when you're using the Smovey on the foot, you're also treating all the other reflex points and all the other areas of the body as well. So it's not just a foot treatment; it's a whole body treatment when you're working on the feet with the Smovey treatment. Like, so now I'll just come back up over the glutes and work back up towards the sacrum, and then I'll switch and come over to the other side, and I'll work the glutes on this side. Again, spending a minute or two on each muscle group.
And you don't need particular training for this, John. If somebody wanted to get one, you would show them how to do it?
Yeah, if you wanted it, you could purchase a Smovey, and if you weren't sure how to use it, you could pop up anytime and we could show you how to. We could go through the the major points to concentrate on when you're doing a massage, or working on your own family, your kids, like, you know.
Yeah, you actually use it on your own kids.
I do indeed, yeah, calms them down. Yeah. Especially before bedtime.
Yeah.
So now we're going back down onto the hamstrings here. Now and then we come back over onto the knee. And again as well, there's lymph nodes in the back of the knee here, so you're stimulating the lymph nodes as well. Stimulating the lymphatic system, and you're helping to detox the body on top of that.
So if women had swollen feet, or if pregnant women have swollen feet, that would be good to do that? Yeah. Normally what you do is you'd work from the stomach around and then down towards the backs of the legs and front of the legs as well. And you concentrate more on certain areas of the body. So again, come down and do a treatment over the tendons. And back up along the leg. So what I normally try to do then is, when I'm finished, is just walk up towards the sacrum and the lower back, because that's where most people kind of hold their tension. And I'll just finish off around this area. I'll come into the lower back, just rock back and forth. How's that feeling overall, Peter?
Good, yeah. Keep going, eh?
You keep going. Okay. You'll find then that relaxes all the muscles in the lower back, stimulates circulation, and it just gets a person ready then for deep tissue work as well, if that's what they want. Like. Okay, and that's me finished.
That's great, John. Thank you very much.
No
so
problem.
If anybody would like more information on the Smovies, they can contact me through the website, and if you would like to purchase a Smovey, contact myself or John, and he can show you how to do that massage. Thank you very much.